Local anesthetic explanation. Introduction. Local anesthetics are drugs that produce loss of sensation in a limited area of the body without causing loss of consciousness. They act reversibly by blocking voltage-gated sodium channels in nerve membranes, thereby preventing depolarization and impulse conduction. The loss of sensation occurs in a specific order: first pain, then temperature, followed by touch, pressure, and finally motor function, and recovery happens in the reverse order. The non-ionized, lipid-soluble form of the drug crosses the nerve membrane, while the ionized form binds inside to block sodium channels. Chemically, local anesthetics are weak bases and are classified as either esters or amides. The ester group includes drugs like procaine, tetracaine, cocaine, and bentocaine, while the amide group includes lidocaine, bupivacaine, mepivacaine, prilocaine, and etidocaine. Esters are hydrolyzed by plasma pseudocholinesterase, whereas amides are metabolized in the liver by microsomal amidases. Allergic reactions are more common with ester compounds due to the formation of para-aminobenzoic acid, PABA. Amides are more stable, longer-acting, and rarely cause allergy. You can identify them easily. Esters have one ine in their name, while amides have two ices. Depending on their site of use, local anesthetics are divided into types like surface, topical, infiltration, nerve block, spinal, epidural, and intravenous regional anesthesia. For surface use, bentocaine, tetracaine, lidocaine, and cocaine are common. Lidocaine and procaine are used for infiltration anesthesia, while bupivacaine and lidocaine are used for nerve blocks. Tetracaine, bupivacaine, and lidocaine are suitable for spinal anesthesia, and bupivacaine or ropivacaine for epidural anesthesia. Lidocaine is the most common choice for intravenous regional anesthesia, Beer's block. Proparacaine and tetracaine are used in ophthalmology, and lidocaine is widely used in dental procedures. Cocaine is unique because it produces vasoconstriction instead of dilation. The duration of action varies between agents. Procaine is the shortest acting, 15 to 30 minutes, lidocaine has intermediate duration, 1 to 2 hours, and bupivacaine is the longest acting, 4 to 8 hours. Ropivacaine and etidocaine also have long duration with less cardiotoxicity. Drugs that are more lipid-soluble and highly protein-bound have greater potency and longer duration. Local anesthetics are weak bases, and their onset is faster when the pKa is close to the physiological pH, 7.4. In acidic environments such as infected tissue, the drug becomes more ionized and less effective. To prolong the effect, adrenaline is often added as a vasoconstrictor to reduce systemic absorption. Pharmacokinetically, the unionized form crosses nerve membranes easily, whereas the ionized form acts at the receptor site. The rate of absorption depends on the vascularity of the tissue, therefore, adrenaline reduces absorption and toxicity. Esters are metabolized by plasma cholinesterase and amides by hepatic enzymes. Because of this, infants or patients with liver disease are more prone to toxicity. Local anesthetics can cross both the placenta and blood-brain barrier. Adverse effects are mostly dose-related or accidental intravascular injection. Early symptoms include tinnitus, metallic taste, circumaural numbness, and dizziness. At higher concentrations, CNS stimulation causes restlessness, tremors, and convulsions, followed by CNS depression and respiratory arrest. Cardiovascular toxicity manifests as bradycardia, hypertension, arrhythmia, and is especially severe with bupivacaine, which is highly cardiotoxic. Allergic reactions occur mainly with ester-Las, while methemoglobinemia may occur with prilocaine and bentocaine. Other side effects include nausea, vomiting, urinary retention, and hypertension, especially after spinal anesthesia. To prevent toxicity, aspiration before injection is essential to avoid intravascular entry. Use the minimum effective dose and add adrenaline, 1:200,000, to prolong action. In case of toxicity, management includes oxygen administration, airway support, and 4-lipid emulsion therapy, especially for bupivacaine toxicity. Diazepam or thiopental can be given to control convulsions, and cardiac monitoring should always be done during procedures. Local anesthetics should not be used in infected areas due to acidic pH and must be preservative-free for spinal or epidural administration. Among the commonly used drugs, cocaine produces euphoria and vasoconstriction. Lidocaine is considered the gold standard. Bupivacaine is long-acting but cardiotoxic. Ropivacaine is safer with similar efficacy. Articaine is used in dentistry. Bentocaine is only for surface use. Tetracaine is potent and used for eye and spinal anesthesia, and prilocaine is less toxic but may cause methemoglobinemia. Etidocaine has rapid onset and long duration, while the eutectic mixture of local anesthetics, EMLA, cream combines lidocaine and prilocaine for painless skin procedures. Physiologically, smaller and myelinated fibers are blocked earlier than larger fibers, and pain fibers, C and A, are the most sensitive. High-frequency firing nerves are blocked more rapidly. Local anesthetics work better in alkaline pH, while acidic conditions reduce their effect. Except for cocaine, most LAS cause vasodilation. They block both sensory and motor fibers, hence loss of movement can occur along with loss of sensation. Adrenaline addition reduces bleeding and prolongs duration. Clinically, local anesthetics are used for minor surgeries, dental procedures, nerve blocks, spinal and epidural anesthesia, and to relieve neuropathic pain like postherpetic neuralgia, as topical patches. Lidocaine is also used as a Class IB antiarrhythmic drug in cardiac arrhythmias. Topical forms, gels, sprays, patches, are used on mucous membranes and skin. Tetracaine and proparacaine are used in eye procedures. Spinal anesthesia is given into the subarachnoid space, L2 or L3, and epidural anesthesia into the epidural space. The combination of LA with adrenaline provides longer anesthesia with less bleeding. Contraindications include allergy to the drug, infection at the site, heart block, and severe liver disease, especially for amide types. Thus, local anesthetics, though extremely useful, must be administered carefully considering their pharmacology, duration, metabolism, and safety profile to achieve effective and safe regional anesthesia in medical and dental practice.